Welcome to the beautiful struggle.
My name is Brian.
Hi, TJ Goodman here.
And again, welcome to the beautiful struggle. Today we will be discussing the health gap. Why does it exist? Before we get into that, let's talk about the organization itself. Black Advancement Incorporated is a nonprofit organization that seeks to create a unity within the Black community through action and discussion, this being the discussion portion. First, to start off our discussion on why the health gap does exist currently will be TJ. TJ, over to you.
All right. So this was, as we were discussing before we started the recording, this is a very broad topic. So broad that I kind of sliced it into four pieces from a research standpoint. I called those pieces or tabs rather dietary, which of course has to do with what we put in our mouths. Coverage, which has to do with our ability to be part of the health insurance coverage system, access to healthcare, and then one I just called environment, right? So we look at this thing from the beginning. You know, of course, the beginnings of us in this country were slavery, right? Brought here against our will to do work. And so in the dietary category, slaves, I mean, generally slaves were given limited diet, right? That was designed to be cheap, designed to be easy to prepare. That I wouldn't say that they gave them exactly scraps, but it's not what they were eating, the people that owned them at the time. So their food was typically like low protein and low in other essential nutrients. And this led to a bunch of health problems for them, right? Health problems like malnutrition, of course. Anemia would be another one. Dental problems. I mean, it just the list goes on and on. But of course, we are not slaves in this country anymore, but we are still, by and large, experiencing a lot of poverty. So, poverty, of course, also comes with its share of dietary issues, and we fall into that category a lot. Food insecurity was a big one, right? So, for those of you who don't know what that is, that's defined as like a lack of access to enough food to live like an active and healthy lifestyle, right? Of course, food insecurity leads to malnutrition, hunger, a range of health problems, and basically you have limited access to healthy foods, right? We're more likely to live in food deserts, which, again, you see how this problem just keeps on spinning on top of itself. Having limited access to healthy foods puts you in a position where you're reliant on low cost, like nutrition poor kind of foods, right? So those tend to be, high in calories, low in nutrients. So we were talking about like fast food, processed stuff, sugary beverages, right? And these things, kind of lead us to issues where we have obesity and diabetes and other kind of issues. And then, of course, from a dietary perspective as well, there's we talked about education gap before. There's an education gap when it comes to this as well, right? If you're in an area where you don't really know a lot about nutrition and eating healthy, then of course that is also going to perpetuate your issue. So from a dietary perspective, that was kind of what my research led me to believe as part of the gap, right? So it started way back in the beginning, and it perpetuates today. From a coverage perspective, I'm actually not going to go through every single thing that I've got here because I'd be talking for the next 20 minutes. But let's just say that there were only two real, what I'll call wins from a coverage perspective that I saw for us. One was like during the Reconstruction era, which is right after the Civil War, where they would, they give like newly freed slaves, vaccinations, medications, and some hospital care. But of course, as you know, that era was only about 12 years long, right? And then, crazily, 2010 is really the next time that we got anything that you could really consider some kind of a win from a coverage standpoint, and that was the Affordable Care Act. And when that was signed into law, at least for a change, Black Americans actually fell under the provisions of being able to get some coverage. Part of the reason for the health gap in the coverage. And like I said, I'm not going to go through all the different reasons and different, I guess, projects that excluded us from being covered. But it's a pretty well known fact. I mean, historically, even the private health insurance policies are often, they exclude pre-existing conditions, which, like I was saying about the dietary portion, you end up with pre-existing conditions when you have poor diet, right? But they'll exclude pre-existing conditions, and and we're disproportionately affected by things like that. Then if we talk about access to healthcare, right? First and foremost would be a lack of health insurance, right? We're more likely to be uninsured than other racial and ethnic groups, which of course can make it difficult to get access to quality healthcare and healthcare services. Discrimination is a problem from healthcare providers, right? And if there's discrimination being experienced by healthcare providers, then some of us don't really trust the doctors and stuff anymore, right? So that leads to mistrust, and you're reluctant to even go there because you're afraid that you're going to be misdiagnosed or undertreated or something like that. So that also helps to contribute to the disparity. There's geographical kind of barriers, right? We're more likely to either live in like way out in the sticks in the middle of nowhere, like when we talk about the middle of the country, or low income urban kind of areas where it's difficult to get access to really good quality healthcare down there, right? So, and then of course, there are financial barriers as well to getting good quality healthcare. If you're in a situation where you have to pay a really high copay or really high deductible or something like that, that puts you in a position where you can't really go to get care as regularly as you should. And then the last one, environmental type factors. So this one I will go through really quickly. So one I have down is air pollution, right? We tend to live in areas that have higher levels of air pollution, right? That can lead to respiratory problems, heart disease, other things. Water contamination, I think we've all seen that on the news with places like Flint, Michigan. Those kinds of issues tend to hit our communities more frequently and a bit harder. Those kind of things can, cause everything from birth defects to neurological issues to cancer. Lead exposure, we're like more likely to live in homes that have lead-based paint and stuff like that. And a crazy one that I saw was they said they were disproportionately affected by climate change, which at first I was like, what do you mean by that? But then as I read a little bit further, it's really talking about the extremes. If you live in these urban areas where there's extreme heat and there's issues with air conditioning and things like that, or the opposite where you have like extreme blizzards and stuff like that. If you live in an area that is not going to be addressed when there's problems, then of course you're going to be disproportionately affected. Hazardous waste, we tend to live more near that, and landfills and stuff like that. Neighborhood conditions, of course, can lead to health problems. But I think highest on the list is that I think is probably stress is a big reason for it. Research consistently shows that being Black in America is, it's associated with significantly higher stress than other racial and ethnic groups. And, so just the pure stress of being Black has a real severe impact on your physical health. And that also causes a range of issues, high blood pressure, cardiovascular disease, obesity, mental health disorders, things like that. So I know that I've been talking for a while, so I'm actually going to hand the mic over, but those are the things that I saw as reasons for the health gap existing.
Yeah, those are like a lot of what you said is a lot of what I also have too. I broke mine down into like mainly 3 sections. And then I have this other topic called preventable disparities, which talks about like modifiable behaviors, which include diet, exercise, smoking, how people cope with and understand their own conditions, which is like asthma, diabetes, high blood pressure. And that all falls into like the other topic I had, which is health education and awareness. So that's the reason that's important. And we fall short of that is because obviously in a lot of the inner city school curriculums or just school curriculums in the whole, in general, they don't talk in depth about health and how you can basically prevent a lot of the diseases. That's not like honed in, especially for Black people in this country. So, and another thing that I found that was interesting about health education and awareness, or health as it deals with education, is that it showed that life expectancy grew for those that were educated more with 16 plus years of education. There was a direct correlation between those that lived longer and had higher education. And that could be a number of factors. When you go to college, you meet a whole bunch of different friends that become lifelong contacts, whether that's doctors, lawyers, Wall Street bankers, and you're connected to get those type of educational things from them, and they can teach you certain things. If you don't go through those things and you're still stuck in your own environment, which may not be good for you, you don't know these things and you suffer because of that. I'm just giving you a base elementary explanation of that. The main thing for me is financial, from based upon my research, and that comes with insurance coverage, more so affordability with that, because you can also live in poverty, still have a job, still have insurance coverage, but not be able to afford the deductibles and the premiums more so that come along with taking care of you and your family. If that's the case, then you don't get the best medications because you'll have to go to the generic brand that may not help your condition the best way. Or you may not get the best doctor that can help you out with, that's the most competent, because you just can't afford it. What else? Pre-existing ailments was a big one too. That could be a factor that can hinder. That was more so of an issue, I think, pre-2010. There was a whole bunch of laws enacted where people couldn't like discriminate against you if you had pre-existing conditions. That was all part of the Affordable Care Act and whatnot. But I'm pretty sure there's ways around that still. And let's see here. Oh, there's one other thing I also wanted to talk about too. Given all this information that me and Teddy are talking about, from 2010 to 2020, the uninsured rates did fall from 20 to 11% for Blacks, compared to 13 to 8% for whites. So even with that uninsured rates falling, we still fall behind for most minority groups. I think the percentage leap, I think, was the largest for Hispanics also. I forgot the percentages, but they were large for them too. But we still fall behind in the preventative care, because even though that number fell, we still don't do health preventative measures like going to the doctor once a year, doing prostate examinations when you're of age, for females, breast examinations, all those things that can help you and detect, these health issues, even when you do have insurance. So those are some of the things there. And region was another big thing too. There was one study that showed that southern states typically have people with higher cardiovascular health issues based upon diet, going back hundreds of years on how they eat and whatnot. And they also in those areas tend to be much more uninsured. It's a large majority of African Americans that live in this area which suffer from this. So they have non-adherence to health preventative measures, and their primary source of care is not from a primary care physician. So that personability and accountability that your primary care physician can give you, they don't get, because their primary care source is going to the emergency room when something's wrong. So that was a huge factor in the disproportionate healthcare for African Americans. And then a lot of those places have grocery deserts too. If you don't live near a farm where you can get fresh produce, or a grocery store like Whole Foods or Trader Joe's that provides, much more organic or natural fruits, you're not going to get the stuff that you need. You're going to eat low protein stuff, high sugar, whatnot. And the environmental factors too play a very big part. I have a point to make with global or climate change. So back where I grew up at, we got hit with a lot of different hurricanes for the last 5 to 10 years, and it's flooded the area a lot more than what it normally would. And I actually knew a girl that actually died, who lived in the projects, because she couldn't get out, because she lived in the projects, didn't have means to get out, whatnot. So that would be another example of how climate change can, disproportionately affect those that are underserved. They don't get like the FEMA, what's the word I want to use? Preferability when the emergency comes. They're usually the last to be taken care of, and they don't have the means to help themselves. So they actually should be helped first. And in a lot of those areas too, it's not a lot of competent, qualified medical professionals in certain important neighborhoods. So they may get a lot of people that are maybe a little bit more educated than them, but not as educated as they should be in that profession, as opposed to some other communities. So a lot of the times they're either misdiagnosed, undertreated, overtreated, which can lead to much more devastating effects. So that was a lot of what I researched and found. I know I rambled, so we're gonna stop.
Excellent. Good. Now we will move on to our discussion portion, where I will just be quiet and let you two talk it out as far as what you've seen. So on to you guys. TJ?
Man, what to discuss? We had a lot of similar research because it's a historic and a systemic problem at the same time, right? I mean, we've had this issue from the moment that we arrived here, and the dietary piece, I think, that's a big start, right?
Right.
A lot of these other things, in my opinion, can be avoided, or at least stiff-armed, I'll say,
mm-hmm.
if you're eating a quality diet. And it's really just such a crazy cycle. I mean, and some of the stuff I didn't want to get into detail with before with the coverage piece, because I actually had broken down some of the different, like the National Housing Act and the Social Security Act and all that, all these things where there was, kind of a nationwide push to try to help with this situation, but we were always excluded from being covered, or even if you were covered, when things are segregated, you can't go to get the medical care anyway, even though you're technically covered. So it was, honestly, it was a little discouraging too. I mean, these are things that you kind of know, because all of us are part of the community. You kind of see it and you kind of know it, but doing the research and actually following it from the beginning until now, it was a little discouraging. Like I said, I only saw 2 wins out there from a coverage perspective, but I mean, there's still hope, of course, because there's a lot more access to information now because of the internet. But we got to get that, of course, to be a little more widespread in the neighborhoods today that not only are in food deserts, but they also probably don't have, great connectivity to access this information.
Agreed. And I'll say like dietary is definitely a big part in that as well. It's just, if you think back about how like in the education system, you learn about the food groups early on, and it kind of stops like after a certain grade, so you kind of tend to forget it. So if that's not being taught at home, or just being talked about in general, or if you're not actively looking for it, you kind of fall to the wayside and tend to eat fast food a lot more, and whatnot. So I think, having a much more proactive approach and making sure that you eat an apple or orange a day in the morning along with whatever you're going to eat is important, because that can literally help you in the long run. I think that's very important, preventable care, so that you understand that, going to the doctor, going to the dentist once a year, getting a cleaning of your teeth and flossing, twice a day or brushing twice a day can help you out in your overall general health. That hasn't been talked about a lot based upon my experiences growing up and a lot of people I've talked to as well. But I think it's getting better now because, the internet, you got YouTube and whatnot, you have doctors online on YouTube talking to people, just TED Talks that talk about it. If you're fortunate enough to get a certain job, Your job will, offer you better healthy snacks within the job that are free, or they'll kind of like I've actually experienced this. That's what I'm talking about. They'll put healthier vending machines there for you to make sure that you stay energized throughout the day. That's a good thing, but a lot of Black people don't get those types of jobs. So if that's not pushed on them, they're not open to that idea. And if they have a high stress job, that's going to cause them to eat less, sleep less, eat less healthier options, sleep less, and increase their stress, which in turn causes them to exhaust their insurance coverage, unfortunately, unnecessarily, and it doesn't have to be that way. So all those like nuances in regular life that people don't think matters, in my opinion. So.
No, I agree. I mean, preventative care is huge, right? And everything, stuff you're talking about, kind of reminded me of that. If you can take care of yourself before you get sick,
yeah,
do the things that you need to do to try to prevent those things, and ultimately that life expectancy goes up. That was another staggering thing. I saw like a life expectancy thing of Black Americans next to other races, and we were at the bottom there as well because of these things.
Exactly. I think I saw something that said that they did a comparison. I forgot the guy's name. It was like Chris something. He did a article or a study called "The Eight Americas" and section off 8 different portions of, I think, races or ethnic groups of people in America, and Black males were 20 times likely to live longer. No, sorry, 20 times likely to live less, or 20 years younger. We would die 20 years younger than, I think, Asian females or something like that. It was crazy. So like they had 20 years over us just based upon like where Black males majority live and the dangers that we face, I guess, whether being in an urban environment or just our health in general, which is crazy. That was actually kind of scary.
Yeah, no doubt.
Man, that was a good discussion. So let's get down to brass taxes here. We're going to slide into our final sections, which is the solution section. If you don't have a solution, that's fine. This is a big problem. It's been a problem for a long time. You can just simply say pass on this, or you can just come out with a suggestion and we'll move forward from there. So I'll start with Brian on this one as far as who has a suggestion as far as for a solution. So Brian, what you got?
Cool. Yeah, I have a couple of different solutions. I'll go back to insurance coverage and a different type of insurance coverage. I think life insurance is important as early as possible. So if you can get life insurance as early as possible, then in turn, as a whole for Black people, in turn, sorry, hang on. Come here. She's fine. It's all right.
No worries.
So if Black America as a whole can focus on getting life insurance, it would be a domino effect and cause a lot more. They would want to invest more in us being healthy. Long story short is what I'm trying to say. But as a community ourselves, I think that, focusing on diet is very important, making sure that our families eat healthy, eat like whole meals that include every food group consistently every day. We prioritize, sleep, proper sleep, I should say. And sorry, guys. Proper sleep and just overall health in general, not only when we're in sports and whatnot. It'll definitely help us out. I think that's definitely the solution, and making sure that we take advantage of our insurance coverage, read the fine lines in between that. We take the measures to take our preventative care seriously and take advantage of going to the doctor every year and pressing them to make sure that they give us the information they need. I think that's very important. I know I do it as much as I can, and it's benefited me. So,
indeed, TJ, what are your solutions as far as suggestions for a solution?
I like those suggestions. Of course, education is always important. Getting people to know and understand what their that the dietary practices that they've been engaged in up to this point is not going to help you to sustain a healthy life. And I guess as a solution, once that education is gained, making sure that gets passed down, right? We talked about the diet way back in the day, I mean, all of us have had soul food. We all love it. It tastes good, right? I mean, that's just the way it is. So, but it shouldn't be your everyday, right? You need to make sure that you mix it up some. So that's one thing. Another solution would be to, I guess I would say, I think most doctors are probably on level. You know, they take their oath seriously, but there have been not just a few, there have been several, you know, kind of horror type cases where we've been misdiagnosed, mistreated, and those, unfortunately, you know how it is with bad things. Those are the things that get echoed the loudest. So, I mean, if I was just going to throw something out there that everyone's familiar with, like the Tuskegee Airmen thing, what happened with them?
Right.
So those kinds of things breed mistrust. So I guess trying to make sure that we build trust in our community for the healthcare providers, and that they actually enter the situation, fairly, right? Treating everybody the same would be another one. Yeah, and of course, figuring out some way to budget where you can get a little bit of help, even if it's not like great insurance, health insurance, having something to help out would be good. Even if it's, something, quote unquote, minimal, or to have like an HSA or something like that, where you're continually putting money away for that rainy day for your health that, kind of sits there. So if you do have problems, you can dip into that to help out, and you don't have like one huge crazy bill that wipes you out completely. And it doesn't even have to be you, right? I mean, you could be trying to take care of somebody else. That often happens to us as well. Where some family member that's important to you is experiencing some medical issues, and all of us kind of band together to try to help them in this situation. And unfortunately, it may leave you in a situation where you can no longer cover yourself if something happens. So yeah, there's I guess a wide range of things that can be done, but I think at the top of that list is preventative care and education to that effect.
I agree.
Fantastic. Well, that's all for today's beautiful struggle, I should say. Thank you all for watching. You can see this and more at the Black Advancement's YouTube channel or at our website, which of course is www.blackadvancement.com. Till next time, peace and advance.